Dr. Ian Barwick, our Patch Family Chiropractic. Thank you so much for joining us. Really good to have you. I know you and I have had some, we'll just say casual conversations before, but never really got to sit down and do any kind of deep dive. So excited to see what we got to talk about today.
Yeah, man, excited to be here. Thanks. I think this kind of a way of doing meetings is awesome, and getting this podcast room ready.
Yeah.
It's really cool, man.
Thanks. And yeah, it's like I've had enough breakfasts and coffees with people for the rest of my life, Not to mention that, I mean, not trying to be a cheapskate, but like, it's just like, I don't need to just go spend $10 or $15 just to check the box that I met with somebody, when in reality, we could do something that might add value to both of our businesses. So
right. Yeah, it makes sense.
That's the whole goal, whether it is our conversation or the ability to distribute it. So that's what it's all about. Well, hey, I know you're in business with your wife, which is really cool. So talk to me about that. What's that like to be able to, be in business with your wife?
Yeah, it's a lot of fun.
Okay.
A lot of people are like, oh man, I couldn't spend that much time around my wife, but it works. It works really well. And obviously the personalities have to match, but the kind of how we do it in our office is we do kind of have separate spaces that we see each other. So
okay.
Naturally, when you spend all day, every day around anybody, you're going to get moments where you need to take a breath or something like that. So it helps when we have separate spaces that we actually take care of people out of. So we're not, even though we work together, we're not at each other's throats all the time.
For sure. That's nice.
And it's a lot of fun. I couldn't imagine not working with her. We're, in the process of growing our family and looking at what the future holds as far as, what are our hours going to be and all that stuff, and new people we're going to add to the team and all that kind of working together. And, the idea has floated to separate our practices into two different offices. And I'm just like, I don't want to do that at all. I want to keep our family practice as a family.
That's really cool.
Keep working together. And I couldn't imagine not doing it.
So you talked about bringing other people in though. So what's the next step with all that? What's your vision for growth?
Well, my wife has pretty much told everybody, so I think I can I think she's going to tell Instagram before we air this podcast.
It'll be at least a month. Don't worry.
Perfect. Yeah. So she's pregnant.
Cool. Congratulations.
Thank you. We were due in October. And so we're have already met someone who we plan to have as our kind of what we call a locum doc, which is someone who comes in temporarily to take care of our patients, to kind of keep the patients being seen, but not necessitating Ashley to be there freshly postpartum.
Sure.
So she can have maternity leave. And then the idea would be to hire an associate after that to expand our team, to kind of give Ashley specifically more flexibility around raising our family.
Yep. And then are you guys going to be able to do that in the space in the building that you guys are in now, or is that going to look like having to find a new space?
It's going to be fine in our current space. Changing the hours around a little bit. Okay. Will be required, but there's plenty of hours in the week that we're not in the office. Yep. And so it would actually work out better because then we can have those hours filled and maximize kind of the space we have without having to increase the overhead by getting a bigger space and going through the headache of finding a new space, as I'm sure you're
very familiar,
acutely aware of.
Acutely aware, yes. It's like, at first, the prospect of signing a 5-year lease is like, oh gosh, I don't know if I want to commit to anything for 5 years. Then once you go through the whole process, you're like, I want to go 5 years without going through this process again.
Yeah. At least, can I go 7 years? Is that
exactly.
a thing?
Exactly. I might just try to buy the building afterwards if I can, because the process of moving and finding a new space is just so hard. Yes. I totally get it.
Yeah.
So I know you have a unique approach to chiropractic care. So talk to me about that.
Yeah, so the specialty is called NUCCA. It stands for National Upper Cervical Chiropractic Association. And in a nutshell, we look at, the upper cervical spine. And, it's a unique region in a lot of different ways. And so as an upper cervical chiropractor, we take care of that region and tailor everything to the patient's anatomy and their unique injuries, experiences, and misalignment, biomechanics patterns, and all of that. And the adjustment itself is also very different because it doesn't require any popping or twisting. Okay. You're as a patient, you're basically lying on your side, and I apply gentle pressure to your upper neck. And, I joke because I tell people what to expect, and I say, and then you're going to feel like I'm just touching your neck and nothing's happening. And then I'll do my rechecks, and you'll find that, oh, muscles are stronger, and my shoulders are now balanced, whereas before one shoulder was higher than the other. And I feel different, and I don't exactly know why. And, it's just a unique approach that's the niche that I found and that I really enjoy.
Yeah, I was going to ask, did you have an experience that led you specifically to that specialty, either during some of your education and training or as a patient yourself? Like what specifically caused you to become fascinated with the upper cervical spine?
Yeah, I would say a little bit of both. So I'll take you through my I guess the abridged version of how I became a chiropractor.
Sure.
In my early 20s, I was a personal trainer.
Okay.
And I was, in best shape of my life and eating right, but dealing with chronic pain and dealing with really bad anxiety and depression and all the things. And I was like, man, I don't want to go in pharmacology. And if this is the rest of my life, this is a bleak life. And I don't like that. So I went for some solutions, and there was a chiropractor at my gym. And so I started talking to them, and she was kind of explained that, chiropractic's not just about neck and back pain. There's other benefits that people can experience. So I said, okay, well, let's give it a shot. And, in very quick time, my pain levels were way less. Within a month, I wasn't having really any anxiety anymore. I hadn't had a panic attack since like the second week of care. So it was just a major physical and emotional benefit that I saw. And so I was like, okay, cool, I'm going to be a chiropractor. And this chiropractor was more traditional in their approach. So kind of a little closer to what you would expect, with the lying on your side, pop, lying on your other side, pop, that kind of thing. But I still got great results. So I went through school, and, through the course of training, I found that my healing journey kind of plateaued about midway through school. And so trying to find out how to get to the next level, as you might, you might do, I came across upper cervical. And so I started in that route, and I found that kind of brought me to the next level. And so I was looking at upper cervical, and there's a couple of different approaches, not to get too much in the weeds, but within the chiropractic upper cervical realm, there's a couple of different approaches that we can kind of go to.
Okay.
And when I found NUCCA and saw how least invasive it was, but also how everything we do is verifiable and provable with post x-rays to verify that we made the correction that we want. Everything we do is saying, yep, this is what I did. Let's prove it. Okay, cool. It worked. Great. Let's move on. Oh, it didn't work. Let's change something so I can make it work. And so it's a lot more customizable in that way.
Yep. Do you have instances where symptomology and imaging don't agree, right? As in, like, either imaging improves but symptoms don't, or symptoms improve but image doesn't really change?
Yeah.
So how do you explain that?
I think everybody is trying to explain that right now. As much as we have found out about anatomy with the imaging that we have and people's physiology, and there's still so much that we just don't have the imaging for, because some of the structures in live tissue are so small that even with our current MRI technology, you can't see these tiny. You would need a huge magnet that we don't have to actually be able to see, these tiny little ligaments that might be there, or that are there in cadavers, but we don't know exactly how they react in a live environment.
Correct.
So my theory is there's always going to be that discrepancy, and we're going to continue to get better as we have better imaging and better techniques. But yeah, that happens all the time, where we'll do an adjustment and we'll see perfect correction. We got exactly what we wanted, and they'll come back saying, "I don't feel any different."
Right.
And they're like, "Well, I don't understand that," but okay. Right. And then we'll have other times where you're like, "Well, I've tried 4 different times. I can't seem to get your structures to move too much. Let's try again next time, or let's change our approach in some way." And then, but we did a lot right now, so we got to let you settle and see what we have next time you come in. And then they'll come in like, Doc, I feel so good. I feel better than I have in years. And I'm like, well, I guess we'll keep doing what we did, you know?
Exactly.
I mean, that's the nature of it.
Yeah. You know, we all have perspectives on imaging, and one of mine is that first of all, we don't do it in our office. We certainly refer out for it when we feel like it's necessary, but we just try to let people know that imaging is meant to be a data point, a piece of information, but it is not meant to take the place of what you feel inside your body, right? And the other thing is that we've seen plenty of cases of people with really bad imaging that don't really feel that bad, right? You know? And so just like, it reinforces that it is a part of the story, but it does not tell the whole story, right? You know, there's people that have debilitating knee pain, for instance, that have perfectly clear x-rays and MRIs, right? Then there's people that have horrendous knee pain, like I can barely walk, whatever, and their MRI does look really bad. What's the difference in those two people? Is it their MRI or is it something else? So I think what you were getting at is that we don't understand the nervous system completely, right? So some of the things that you're referencing, right, when you're like, hey, this person feels really good, and yet their alignment or maybe just the mechanical changes that we're trying to make, I don't have the evidence to say that we made those changes, and yet they feel better, right? And so the one thing that we try to add on for our clients is that, you know, if I told you that your image would never look perfect, but you would feel better, would you be okay with that? I've never heard somebody tell me they're not okay with that, right? You know what I'm saying?
Absolutely.
So the other thing is like, we're not going to treat you to the nth degree outcome of, I need this image to look 100% perfect, because the minute that you're able to do everything you want to do and you subjectively are functioning at a much higher level, we're not going to sit here and say, but that's not good enough, right? You know, like I want people to know that, like, unfortunately, bumps and bruises, aches and pains, gray hairs, it's a part of life.
Yeah.
Right? I wish that the human body would ever get back to some level of perfection or function. But like you said, right? If we had a magnet strong enough, I'd be able to find something wrong with you. Right?
Yeah.
You know what I'm saying? Right? So I just guess I'd ask you, like, how do you handle some of those conversations where you maybe have that person that, I mean, hey, I guess if you want me to keep doing this forever, I guess I can keep doing this forever. But at some point it's like, you're good. Like, we did it. High five. Like, let's be happy about this.
Yeah.
So how do you handle that?
I mean, it kind of all comes back to expectations and setting them. And one of the big ones, as you just pointed out, is like, okay, your curve is 25 degrees diminished. There's nobody on planet Earth that could get you back to a perfect curve.
Sure.
That's just not feasible. You have degeneration. There's a lot of factors. And so setting that expectation, like, hey, but if we improve your curve by 5 degrees, there's a whole lot of good that's going to come with that. 10 degrees, there's a whole lot of good. And so even though it's not going to be a perfect curve and the imaging isn't going to be perfect, you're going to feel a whole lot better.
Right.
And part of the checks that we do, which is part of the NUCCA protocol, is checking posture, checking leg length in a supine leg check. And there's a couple of other checks that I use to see if an adjustment is needed or not. And if it's not needed, then I don't adjust them, which tells me that their upper cervical spine is stabilizing and I don't need to see them as often. And so we taper the frequency. Okay, now you're coming every 2 weeks. And then, all right, now you're once a month. Now you're once a quarter. Now you're once every 6 months. Typically, I like to keep people at a once a quarter frequency just for check-ins. I mean, spine is such a dynamic system. A lot of things can happen that in those 3 months to cause someone to lose their alignment, and so to speak. But if someone comes in every 3 months and 2 cycles go by and they're holding, all right, well, then I'll see you in 6 months unless you have a head injury or something like that. Like,
exactly.
Like, I'm not going to keep seeing you. And conversely, too, if someone comes to me for certain symptoms and I start working with them, regardless of whether I get a great correction or not, if their symptoms aren't starting to show signs of improvement in 4 weeks, like it's probably not gonna take, like, it's not gonna say, oh, after 8 weeks it's gonna improve. Like obviously I don't expect perfection after 4 weeks, but you gotta show some signs that what I'm doing is related to the symptom that you got going on. And if it's not, I'll send you to a PT, I'll send you to our neuro, I'll send you to an ENT, whatever the person needs based off that symptom. Because it's not always spinally related.
No, that's true.
There's so many different things that can be a factor in people's health experiences.
So tell me though, I love to hear stories. So just tell me, anecdotally, what are some of or if you had to pick one, just most impactful patient experience that you've had where you've just seen a transformation from being in a dark, dire place to seeing a huge transformation in their life as a result of some of the care that you guys can provide?
Yeah. So I had a couple of years ago, I had a guy, terrible lower back pain and leg weakness that had gone through the gambit of medical care. Had a spinal nerve stimulator put in and then taken out because it didn't work. Had a fusion surgery. Had basically every type of medical intervention you can think of for a lower extremity or like sciatica type pain. And had been addicted to oxycodone and had to get off of that, but was still in kind of like the immediate aftermath. And so really like 10 out of 10 pain and just not living a life that he wanted to keep living.
Right.
And we started working with him, and within 6 months he was able to go skiing. And then
snow skiing or water skiing?
Snow skiing.
That's awesome.
Yeah.
Okay.
And then, as you know, a lot of times with lower back stuff, rotational sports like golf is horrendous on people's lower backs when it's not strong enough for it.
Right.
He loved golf but had to give it up. After a year, he was able to golf, and not taking any narcotics, still dealing with some pain naturally. I mean, there's only so much you can get, but his function was so much improved. Like, he was a different man. That is so cool to watch and see and facilitate that happening.
And was all of that only from treating the upper cervical spine?
Yeah.
Okay. So no other adjustments to the hips, the lumbar spine, and that stuff, just top-down approach was able to create that level of change for him?
Yeah.
Okay, cool.
Yeah. And
how did you explain that to him? From all the other things that he had tried, from narcotics to a spinal cord stimulator to all these other things, and meanwhile, your pain's down here, I'm going to treat this other thing way up here, and here I am, like, I mean, the proof's in the pudding, right? You can say you feel better. It's another thing to function at a totally different level, right? So we're not questioning that it worked. It clearly worked. How for someone like him who's like, man, I tried everything. Why is it that there was something going on in my neck that was keeping me from being able to function at this level?
Yeah, great question. I actually have to have this conversation pretty often, as you might imagine. So the easiest way to explain it is when your upper neck is off, one of the problems that happen is it kind of sends an automatic imbalance to the spinal postural muscles. So the really deep muscles that run the length of your spine from your base of your skull all the way down and attach into your pelvis. When your upper neck goes off, it's very common that one side of those postural muscles are going to contract differently than the other. It's based off of connections into the spinal cord. You torque some of these spinal tracts that control posture. And so they're going to set these muscles at a different length, which causes these imbalance down at your pelvis because all those muscles attach right at the pelvis. And so the problem and pain you start to feel it in the pelvis because that's where everything is attaching. That's where all of that's where gravity is putting all of the pressure, base of the spine, all that stuff.
It's where our center of mass is, right? It's like concentrated force in our body, right? And that's where the most concentration of force is.
Yeah, absolutely. And so as humans, we experience pain, whether it's in the disc or a disc starts to wear down faster, your L5, L4, your pelvis, you start having sacroiliac pain, inflammation, degeneration in that area. And then you can treat that area all day long. But if the cause of that imbalance is from a neurological cause in the upper neck, then it's only going to give you at best a couple of days of relief before the problem builds back up again. And that's what I told him. And so by correcting the imbalance in your upper spine, these muscles are going to release. They're going to be more balanced so your body can actually get to healing things properly.
So we, in our practice, and I told you we had some conversations with some students even up here earlier, we talk about different types of pain, and different types of pain have different types of solutions, right? I'm not going to sit here and pretend like there aren't truly pains of a chemical origin, because there are, right?
Yeah.
Those are the ones that typically respond to chemical solutions,
Right.
right? And when we throw a chemical solution at something and it doesn't get better, rather than saying, oh, well, maybe we just need more of that thing, or maybe we just need to give it more time at that thing, or maybe we should need to find the right combination of that thing. My response as a logical human is to say, it's probably not a chemical problem, right? It might be a mechanical problem, right? Or it might be a sensitivity problem in the nervous system, right? Like all those things are not necessarily chemical problems.
Right.
So it doesn't mean that the chemical things that are out there are completely useless, because clearly they are, right?
Yeah.
Otherwise they wouldn't be distributed so widely and become so highly addictive and all these other things. However, right? Unfortunately, I think there are a lot of times where mechanical problems or like nervous system sensitivity problems, the first solution is a chemical solution, which to varying degrees may or may not be successful. What I will tell them is truly it's not getting to the root of the problem, and therefore it won't provide them a long-term solution, right? It may provide them a short-term solution because some of the chemical after effects of what they're feeling will provide them with some short-term analgesic effect, right?
Yeah.
But the long-term impact is, if we don't get to the root of whatever the true nature of it, again, most commonly what we see would be some type of mechanical or nervous system sensitivity problem, then the chemical effects are either going to be minimal, non-existent, or just very short-lived. And then what we know from chemical pain is that, unfortunately, we build up a tolerance fairly quickly, right? Right? To where it's like, well, 5 milligrams used to do it, but now I got to take 10. And 10 milligrams used to do it, now I got to take 20. And twice a day used to do it, but now I got to go to 4.
Hello, addiction.
Correct. Exactly. Right. So truly, I think one of the most similar roles that you and I play, whether we message it this way or not, is that we are on the front lines of the battle against opioid addiction.
100%.
Right.
Yeah.
And when people talk to me all the time about our practice or just maybe physical therapy as a profession, they say like, who is your enemy, or who's your competition, so to speak? And I would never say another physical therapist. I don't say chiropractors, massage therapists, any of that. The enemy that we fight against every day is big pharma, pharmaceutical companies, right? You know what I'm saying? Like, that's actually who we're fighting against, because unfortunately their desire is never to create a lasting solution for somebody. Their desire is to create dependency. Right. So the way that we try to position our services is to say, certainly there are people that need us and we want to step up and intervene when needed. But we also don't want to take the approach of creating dependency of, I feel like in a lot of cases, if I've got somebody who needs to see me twice a week, 3 times a week for the rest of their life, I've not done them any favors.
Oh, yeah.
All I've done is create this dependency cycle to where, God forbid, Jordan goes on vacation or this person goes on vacation themselves and they don't have access to me for a week. How's their body going to function? Right?
Yeah.
But it's kind of the same thing that happens with medication, right? Like, God forbid they not get their refill in on time. Otherwise, everything's going to crash and burn.
Well, yeah, I mean, I tell people all the time, I don't want you to see me every week for the rest of your life. I don't want you to see me every week for 2 years.
Right.
Like, because at that point, I just feel like I'm an expensive Advil at that point, and you might as well just go get an Advil. It's a lot cheaper.
Right. Exactly.
And your Advil doesn't go on vacation.
Yeah, exactly.
But if I'm trying to get you better, better means you don't need me. Better means your body is able to function in a way where you're able to do all the things you want to do without needing someone else or something else.
Correct.
To do it.
Right.
Independence. That's the goal.
Yeah. So one of the things I had wanted to ask you, I think this might be a good place for us to end, because this will probably spark some follow-up conversation, is that we just get the very general question sometimes from patients. What do you think of chiropractors? And maybe you get the opposite question on the physical therapy side. I have no idea, but we get it all the time. And I'll tell you my answer, and then I'd love to hear your response.
Sure.
So my answer is that I think of chiropractors the same way I think of physical therapists. I think there are some great ones, some okay ones, and some terrible ones. There are people in my profession that I'm embarrassed that they get to share the same title and same license and same name that I have.
Yep.
And then there's people in my profession that, like, I would roll out the red carpet if they walked in this room right now, because I would have so much to learn from them, and you'd probably be better off seeing them than you would be seeing me. Right? Okay.
100%.
So what I tell them is I said, so it's my job as a provider that if I'm going to put my name behind, hey, you need to see so-and-so, that I've done my due diligence to know that this is one of the good ones.
Yeah.
Right. That it's not just, oh yeah, I saw them make a post on Facebook one time, or, oh yeah, I crossed paths with them in a networking thing once. It's like, that's one of the reasons that I want to spend time meeting with providers, is so that I know where people stand in regards to all that. So all that to say, I don't know if you ever get that question about other providers with physical therapists or something else and what you feel about that, but I just think we do carry a burden for our own profession, though, and I'll end by saying this. We do carry a burden for our own profession, is that when we do a bad job, or if a patient has a bad experience with us, that label gets applied to our entire profession now.
Yeah.
Right? I tried physical therapy. It was a waste of time. Doesn't work. Yeah. Right? Or I'm sure same thing probably happens to you. Like,
all the time.
I seen a chiropractor, total joke, waste of time.
Yep.
Don't bother. Right? So yeah, how do you feel about some of the generalizations that get made in regards to our professions, and how we might actually be able to work more closely alongside each other, because we're not so different?
Yeah. It's funny because I think that happens to PTs, but I don't think any other profession in healthcare does that happen to more in chiropractors, because some chiropractors have decided that YouTube and TikTok clicks is a great way to make money.
Sure.
And the most outrageous things tend to get the most clicks.
Sure.
So, yeah, there are some chiropractors out there that I'm very comfortable saying that I would never let them touch me.
Sure.
And others that are like, yeah, this is a great chiropractor. I wish he was down the street and I didn't have to fly across the country to see this guy.
Right.
Or gal. And, yeah, I mean, there are just, like, for instance, the big one that's going on, and I guess this is a PSA, the Y strap.
Oh, the ring dinger.
The ring dinger.
Yeah.
Yeah. Gosh, don't do it.
Right.
Coming from a guy who's an upper cervical chiropractor,
right,
who knows the anatomy of the upper neck,
right,
your head is never supposed to be pulled in that way.
No.
Your ligaments can't hold it. And so you might get some relief, but where's the stability come after that?
Right.
And so I've actually seen and I'm sure as a PT, you've seen people after getting a Y strap or a ring dinger that now they have sciatica that they've never had. That's going to take 9 months for them for you to figure out how to heal.
Sure.
Same thing happens to me. I get people, although it takes some convincing because I'm another chiropractor.
Right.
But yeah, they feel good for about a week, 2 weeks, and then all hell breaks loose.
Right.
Anyway, so yeah, all that to say is, yeah, there's bad fish in every profession.
Yeah, absolutely.
And I hear it on the PT side and the chiropractor side, and you have, yeah, I'll leave it at that.
Yeah, no, that's it. So, I said I was going to end on that, but I have one more question for you, because your approach is maybe a little less aggressive than some others. I literally saw a post one time. It cracked me up online, where somebody was looking for a recommendation for a chiropractor. And they said, they're like, I don't want one of those gentle folks. I said, I want it to sound like somebody stepping on an empty water bottle. That's what I want to hear, that sound whenever they adjust my neck or my back. And that gives such a very vivid image, right? Just,
yeah. Pop me like a glow stick, doc.
That's it. Yeah. So again, what's your response to that when you're like, I mean, you could do what the patient asks for, or maybe you have more of just your consistent approach. How do you manage that?
Yeah, I don't try to spend too much time trying to convince folks who think that they need that.
Yeah.
Because, it's going to fall on deaf ears a lot of times.
Sure.
But what I try to swing it around is they want that because they think that is going to provide them the relief that they're looking for.
Right.
So I just follow up the question like, hey, if you could get the relief, but you didn't need that, would that be something you're interested in? And most of the time they're like, well, yeah. Okay, cool. Let's talk.
Right.
But like, yeah, going in with the negatives, like, oh, you don't need that. The pop is just a pop. It doesn't actually create the change. Like, they're going to be defensive about it.
Right.
So I just, if I say you don't, or if I ask them that question, if you don't need the pop and you still get the relief, would that be interesting? And if they say, no, I want the pop, say, all right, go to the joint, go somewhere down the street. I'm not the guy for you.
Sure. Yeah. Right on. Okay.
Yeah,
well, it's good that you stick to your principle too. Like, you believe in your system. And so you can be confident enough to say it's okay that not every patient is the right patient for me then.
Yeah.
Right. And just be okay. Like, the good news is you're not depriving anybody of care because there's chiropractors on every corner, right? So
Right.
like if you want that, there's other places for that, and that's
Yeah.
okay.
Yeah.
We kind of do the same thing in our model too, where we have some lines that we draw, some things that we will and won't do,
Mhm.
and we don't have to feel bad about that because we go because I can actually tell you where to find that if you're
Mhm.
curious, but
Mhm.
like. But we're not going to be the a la carte PT where you just kind of order off the menu and you kind of tell us what you want. Like,
Yeah.
if you want an expert who's going to help you get through your problem and get you back to what you want to do, sign up on the dotted line. We got you, right?
Yeah.
But if it's just like, hey, well, I really just want somebody to like rub ultrasound in a circle for like 20 minutes on my back, you're like, I'm sorry, this is not going to be the place for you. But
Yeah, one of my favorites is I just need a quick crack. It's like, all right, no.
yeah. Well, the funny thing is, a quick crack. You could probably just look up a couple YouTube videos, and your spouse or your best friend or somebody can probably just give you a quick crack.
Yeah.
If it's just that non-specific and that whatever, like
Yeah.
sure, just go ahead. I mean,
Yeah.
somebody just pick you up from behind real fast, you probably get a quick crack. you
Yeah.
know? Or just
Yeah.
roll
I
around
mean,
on the floor,
you're
fall roller for a second. I get a couple cracks whenever I do that.
You're taking some risk, but hey,
Yeah.
if that's what you want.
That's what you want. Well, hey, Ian, I really appreciate it. Thanks for coming by and spending some time, and I enjoyed our conversation. Very supportive of your practice. I wish you and your wife the best. Congratulations on
Thank you.
expecting your next child, and look forward to more opportunities to chat in the future.
Yeah, man. Thanks for having me on. This was a blast, and
Yeah.
and I look forward to talking in the future.
Before we wrap, do you mind just sharing your contact info with everybody so people know where to find you and your practice and your wife, and if they want to get in touch or learn more about you guys?
Yeah, so our practice name is Our Patch, like Sour Patch without the S.
Nice.
Family Chiropractic, and Instagram handle is Our Patch Family Chiro for the pediatric side of things and perinatal, which we didn't talk about too much, but that's my wife's specialty, is in the perinatal and pediatric side of chiropractic. And then the NUCCA upper cervical side is the Instagram handle is Our Patch NUCCA. So
Okay.
Our Patch NUCCA. And then our office phone is 864-704-0920. Email hello@ourpatchfamilychiro. Website ourpatchfamilychiro.com.
Got it all. All right,
I
cool.
think that covers it.
And we'll make sure we put it up on the screen whenever we post it so
Beauty.
people can see it. But thanks again for coming by, and we'll do it again sometime soon.
Yeah, thank you, Jordan. Appreciate it.
Thank you.